Am I
Good
audible?
afternoon, ma'am.
Yeah.
Yes, you're audible.
I'm Dr. Sridevy, working as Associate Professor in Mother Teresa Postgraduate and Research Institute of Health Sciences in Puducherry. It's a government of Puducherry institution. And I have around 23 years of experience, both in clinical teaching as well as in research activities. I'm very happy to know that the organizers have chosen this topic of nursing informatics for the webinar series. Actually, as it has been introduced in our INC syllabus newly, so it is a great effort to sensitize the audience regarding this topic on nursing informatics as such. And I thank the organizers for giving me this opportunity for presenting this topic on patient safety.
Thank you, ma'am.
Yeah.
Yeah, we can start.
Yes. So let me share.
Yeah, we can see your screen. You can maybe go into presentation mode if that's okay. Otherwise, this, I think everybody can see your screen.
Resume share. Okay.
This is fine, ma'am. We can go ahead with this.
Just put it in slideshow.
Yeah, that's great.
So from yesterday onwards, all the audience have been exposed to various aspects of nursing informatics, I hope. So we have been almost gone through all the basics and the public health informatics, so many other topics as I have seen in the brochure. So now another aspect of informatics is the most important point is the patient safety and clinical risk, how to overcome the clinical risk and patient safety issues related to the usage of informatics. Okay, so that's what we are going to see in the another 45 minutes. So quickly, let's move on to the topic because there are so much of content to be delivered. Okay. So why this patient safety has been included in the syllabus as well as one of the important agenda even by WHO is focusing more on patient safety. So the objectives of this presentation will be dealing with about the definition of patient safety and quality of care and the relationship of patient safety with related to informatics and the function and application of clinical risk management. So patient safety, as we see, it is a serious global public health issue. So as per the estimates, they have shown that almost in every developed countries like India, as many as 1 in 10 patients is harmed while receiving hospital care. Okay. It is estimated that there is 1 in 3 million risk of dying while traveling by aeroplane. That is most common actually. But in comparison with the risk of patient death occurring due to a preventable medical accident while receiving health care, it is estimated to be 1 in 300. That means just imagine the seriousness of this issue or the severity. So I'm just quoting one clinical scenario where a patient is being treated for a potential pulmonary embolism, was treated inadvertently given over 17,000 units of heparin because a smart pump was misprogrammed to run at 1000 ml per hour rather than 1000 units per hour. 1000 units comes to around 20 ml per hour. But instead, it was misprogrammed to run at 1000 ml per hour. Just imagine the consequences. Usually, the smart pump, which was used in this scenario, was equipped with the dose calculation software. So this is an example of knowledge-based clinical decision support system. So this technology is particularly important when high alert and high hazard drugs are being administered. So in this case, however, the available dose checking technology had been turned off and then the pump was operated in a standard mode rather than the smart mode. So only during the subsequent analysis of the error event, it was revealed that to save time, many nurses in the institution were bypassing the safety technology afforded by the smart infusion pump. Okay. So just imagine the consequences. I'm not telling this to threaten you, but just to sensitize with the seriousness of the patient safety issues. Okay. So coming to the definition of, the concept of quality of care as well as patient safety needs to be differentiated well before entering into the topic, because these two terms are commonly used in this entire session. No? So quality of care, according to IOM, the Institute of Medicine, it has been defined as the quality of care is the degree to which the health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So it is proposed that it has been agreed, the definition has been agreed by WHO, and it is proposed that the healthcare should be safe. Safe in the sense there should not be any injury and there should not be any adverse outcome for the patient, and it should be effective. So based on the all the treatment which we are giving for the patient should be effective. It should provide only the good results, beneficial. Okay. And then it should be patient-centered, ensuring the patient preferences, needs, and values in the clinical decision-making process. We have to include the patient, and it should be delivered in the appropriate time, apt timing, the delivered without whenever it is needed and without any harmful delay. Okay. Then efficient. It should be efficient. That is preventing the wastage of valuable material resources as well as time, and it should be equitable in the sense it has to be provided without any regard for any caste, creed or religion or any other personal characteristics. So this is what we mean by quality of care. And the patient safety, as you all know, the patient safety means, according to IOM, it is defined as the freedom from any accidental injury or due to medical care or medical errors. So when we are defining the error, it is defined as in terms of omission and commission. That is the failure of planned action to be completed as intended. That is the omission, or the use of the wrong plan to achieve an aim is the commission. It is nothing but which we are exposed to know in our ethical issues like malpractice, negligence and malpractice. Negligence is almost the synonym of this omission, failing to do what we are supposed to do. Commission is the synonym of the malpractice, doing it in the wrong way. Okay. So omission and commission are the terms which they are used in the describing. So actually, what do the patients want? Whenever any patient who is entering into the hospital needs to be treated in a safe manner, no, in a safe manner, appropriate care, safety, privacy, information. They have all the rights to get all the information, convenience. So these are some of the fundamental rights of every patient who's entering into the hospital. Reasonable care and skill, and the right to be compliance with expecting the healthcare professionals to be compliance with the standards, and the following cooperation among providers to ensure quality and continuity of care. And above all, they have the right to be treated with respect, dignity, non-exploitation of care, effective communication and full information, and consent, that is a fully informed consent, and then good support. So all these things are the basic rights which every patient uh, expect when they enter into the hospital. So how far we are giving them the justice, that is the appropriate quality of care means. Okay. So what do the patient gets in terms of like for example, about the health record. So maybe in the advanced hospital where they are following all the electronic health records, in the private concerns, they may be maintaining it in a proper way where the informatics is in full-fledged, it is implemented and all. So just think of the government hospitals. How do they, what about the status of the documents or the case records? Most of the time it may be fat and disorganized, episode focused. Every time they come, only the particular incident will be there. There may not be the previous visit reports, and it may be different. The format may be different everywhere in different organizations. There may not be any proper integration. Often it may be duplicated or often missing. So all these are the status of the records, maybe in many situations. So when we talk about the errors, medical errors, to err is human. Actually, as per the report published in 1999, 98,000 people die in hospitals each year as a result of medical errors. And 5.2 million medical errors occurring in India annually are almost preventable. All these are medical errors are almost preventable errors according. So this has been done by the Harvard study. And when we look into the type of errors, there are different types of errors like diagnostic errors. There are a lot of misdiagnosis and wrong diagnosis, and then treatment errors may be the wrong treatment, or as well as the preventive errors and other aspects of the errors like the procedural errors or anything. So these are the basics of health informatics, which you have already gone through during the previous sessions might be. So this health informatics, just to recap again, just it is the combination of the information science, computer science, and health science. And then health, this is the health informatics paradigm where we have it is the DIKW paradigm, that is, which says that the health informatics is nothing but the compilation of the gross amount of raw data which has been derived as information, and then from the derived information we acquire the relevant knowledge, and then the final at the top of the paradigm is the wisdom, where we apply the relevant knowledge into practice. Okay, that is wisdom. So as we know, the raw data is the collection of all the basic data which we get in a raw and unorganized form. All the details which we get from the patient history, examination, physical examination, as well as diagnosis, the investigations, all that will give us a raw data or pooled data, that is data one. And from the data, the second building block is we have to derive the information out of the data, whichever is needed related to the complaint of the patient. We have to derive the specific information, and those information, the third step, the next step is from the derived information, we have to gather or acquire the relevant knowledge needed. So from the relevant knowledge, that is not alone enough. So that knowledge has to be put into practice in the appropriate care of the patient. In taking care of the patient, we need to apply that knowledge. That is called wisdom. Okay, so that is the last step. So for example, in this clinical based scenario, Mrs. P is a married mother of 2 8-month-old twins, okay, twin babies. And Mrs. P has been discharged from the hospital after she underwent a reconstructive abdominal surgery last week due to an umbilical hernia. Okay, she is not allowed to lift any weight above 5 kg for 8 weeks after the surgery. And Mrs. P has an insulin dependent diabetes, and she injects insulin to her abdomen several times a day. So this is the case scenario. So you just apply this health informatics here. So what are the data you have here? Almost the mother of, she is a mother of, Mrs. P is a mother of 2 twin babies, and she is a insulin dependent diabetes patient, and she has underwent abdominal surgery last week. So these are the data which we get from this given scenario. And what is the information you derive out of this raw data? So we come to know that insulin dependent diabetics often have, we know this already, isn't it? That based on our previous knowledge, we know that insulin dependent diabetics often have delayed wound heating, and she is having 8-month-old babies, 2 twin babies, no? So the twin babies need to be attended by the mother. So she has to lift the babies many times a day. So these are some of the issues the mother may be facing. So out of these information, what is the knowledge we derive? Mrs. P is having trouble taking care of her babies, and that she is not able to lift the babies after surgery because she could not lift much weight for almost 8 weeks, for about 8 weeks. Okay, and then she is limited in injecting insulin into her abdomen. So long she was using the abdomen for taking the insulin. So now, because of the incisional wound will be there in the umbilical hernia. She has underwent surgery for umbilical hernia, so the surgical wound incision may be there. So she cannot use the abdomen for getting insulin injection. So these are all some of the knowledge we can get from the information. and how we are going to apply that in the patient care. So we need to put all these knowledge into our practice. So we have to see to that Mrs. P and her husband or her spouse or the family members should be encouraged to take care of the child. So Mrs. P should be getting help with her child care in the hours that her children are at home. And then she and her partner should be instructed how to inject insulin, self-administration, as well as we can teach the spouse about the administration of insulin in sites other than the abdomen. Okay. Then, and she should be also closely monitored to take care of her wound, surgical wound, till it get healed. Okay. So these are some of the, this is how we apply the informatics based on the raw data, how we are applying into the practice. So quality of care can be achieved by uh, there are two objectives. One is to redesign the clinical processes. We can redesign the clinical processes as well as by adopting to meaningful use of health information technology. So meaningful use of health information technology can be achieved. How can we use the meaningful use of IT? It can be done by the routine exchange of electronic health information for care delivery and for and quality reporting purposes. And as we have seen in the even in the previous session, sir was telling about interoperability of the systems. So this the system should support interoperability of the systems and routine data exchange. So the data which you are providing should be can be utilized by the other operator. So it can be utilized by like as sir told, interoperability of systems by anywhere. So that is the routine data exchange, and by adopting to standards that support this interoperability. The system itself should provide chances for exchanging the data when and wherever it is needed. Okay. So these are the objectives of, these are how the quality of care can be achieved. And other objectives of achieving the health information technology safety plan is by using another two important objectives we need to think of is to use the health IT to make care safer. And then the second objective is to improve the safety of the health information technology. So to use the health IT as a tool to mitigate and to or to prevent adverse events and hazards regardless of their cause. Okay. Then the second objective is to prevent the adverse effects and hazards that are caused by or closely associated with the information technology itself. So first objective is we should say to that we are using the technology in a safer mode without causing adverse reaction to the patient. And the second one is we should check whether the IT apps and other things should be safe enough to use for the patient. So there should not be any defect in the system, or it should not be, the apps should be used in the proper manner as it was used, as it was designed. Okay. It should be also designed in such a way without any incompleteness or any deficiency or damage. Okay. So this is how these are the objectives, and some of the hardwares which are used to ensure the patient safety issues. So many other devices you would have heard of in other sessions also. So these are some of the apps which are used, apps and devices which are used with respect to the patient safety. So one most common thing is the patient bracelet. So this is very commonly we using, the identification tag, the lightweight and wireless devices which enable the nurses to perform safety checks and safe administration of medications. And apart from that, the hardware, database, and network backbone. So all these will help in real-time access of the patient-specific data and evidence-based knowledge, so that one can make the right decision at the right time. Then the bedside dispensing cabinet systems, you can see in the diagram, this is the bedside dispensing cabinet, and these are the alert tags, identification tags, ID tags. So with digital technologies to keep track of the medicine administration and safety. Okay. And in near future, the global network with synchronous treatment, voice over internet protocol or can be used. That is it is nothing but the telemedicine, like telemedicine, the IP, Internet Protocol Telephony. So it is a method of using the voice calls for the delivery of voice communication or the prescription based on the patient complaints. The consultations can be given voice over internet protocol. Okay, then holographic image transportation within and outside the hospitals. This is nothing but the whole body scanning. So this is again a very useful thing which can be used in the diagnostic processes. And then automated ergonomic based motion beds to prevent bed sores. So this is of again a highly significant in case of nursing issues, no. So like to prevent bed sores, we can use these automated ergonomic based motion beds, or otherwise called as smart beds. So which will automatically change the position of the patient, preventing the constant pressure on particular site. The bed itself will be designed in such a way it transfers the pressure in different parts of the body, and also it prevents the patient from getting from falls. So it gives some alarms like that. Okay. So some of the software which are used to ensure patient safety are patient response monitoring systems, which we commonly use for the vital signs monitoring, the physiological monitors, which we attach for the patients in ICUs. And then risk monitoring software, gathering data for on nursing sensitive indicators. And then intelligent incident reporting software. So not just for reporting, but for decision support. So this incident reporting, already we are in usage of these things, but though not in the SS software, we just maintain it in the records. No, we just have the incident registers where we record all the written record of all the incidents. So here this software and all will be having a format like thing, and we need to just fill in the details to register and it will be recorded. So it is just a software which helps us to record all the incident reports. Okay. Then software reporting PSI, the patient safety indicators. So this is also again a checklist like format like thing where we have to fill in all the details. So this has been proposed by the Agency for Healthcare Research and Quality. So all these are some of the software formats which make our work much easier. Just we need to fill in the details and register and record it. Okay. So other thing is that evaluating the quality and patient safety. So this is the very famous framework which we are very famous with, the popularly known to us as the Donovan process of quality assurance, the structure, process, and outcome model. So this here in the structure we have the physical and organizational characteristics where healthcare occurs. So usually in terms of quality assurance of hospitals and all, we just talk about the infrastructure. Here the structure means the applications or the information, the device, the technological devices and the apps which we are using for the healthcare. And the process focuses on the care delivered to the patient, that is the diagnostic or treatment, the structure or the procedure of how we are utilizing the technology. And outcome here in the sense, the effect of healthcare on the status of the patient and population. So that is the final outcome based on the information technology. What is the outcome of healthcare of the patients? And some of the medication devices, no, most of the times the quality, the health information systems, no, there are more devices which are specifically utilized for medication safety. So one such thing is computerized provider order entry, CPOE. So here this is one of the device which also helps in the and the clinical decision support system. Both of them are mainly used for the successfully, it has been used in the clinical practice to reduce the errors during ordering of medications for the patients. And then in addition to that, the barcoded medication administration, BCMA, and electronic medical administration record. So all these systems have been adopted to improve the safety, patient safety, and streamline clinical workflow, focusing in particular or improving the administration processes at the point of care. Barcoded medication administration mainly to identify the right patient. And another identification technology is RFID, that is radio frequency identification technology. It is just like the bracelet, the patient ID bracelet, no, which where the tag is affixed to the object or a person that functions as a radio frequency transponder, and it provides a unique identification code which a reader receives and decodes the code, the medication, the information contained on the tag, and by transmitting the information, the between the tag and reader, the information is interpreted. And then another common thing is smart infusion pumps, which are already fitted, which have been already equipped with dose calculation and pre-programmed infusion rate calculation, other softwares. Okay, so this is again very useful technology in preventing the medication error, especially with respect to the IV infusions, IV medication administration. So the successful implementation of these BCMA and EMAR, these apps, mainly requires a positive workplace culture. So the leadership, teamwork, and clinician ownership. So the administrators should support the use of all these electronic records and the systems. Only then, if you have a positive workplace culture, we can successfully implement these systems. And other than that, we should have a good training and support. As we know, so even though many of these applications are user friendly, so we just cannot try and use it on the patient, because we are not, this is not any gaming app or any other online shopping app or anything where we will have minimum loss. This is where we are using with the patient's lives. So we need to have adequate and proper training and support. Only then it can be successfully implemented, and then acceptance of the major impact of the work practices by all the team staff, and a usable system with adequate decision support. Only then all these electronic records can be used in the successful practice. Okay. Then another other thing related to chronic illness screening and management. The health IT interventions can be utilized to target patients to improve the access of the treatment and to adherence with the medication. So there are a lot of apps to with the medication adherence apps, and diet and exercise regimens, adherence to recommended screening guidelines, so which will give all the warning signs, and engagement in symptom management. So it will give you all the troubleshoot ideas, whatever the solutions for the problems which the patient are facing. Another important aspect, nursing sensitive issues are the patient falls and patient pressure ulcers. So these are the patient nursing sensitive quality outcomes. So patient falls and pressure ulcers can be located on the vector between the quality and safety continuum. It can be located in the midway. It may be the quality aspect as well as the safety aspect. These issues may arise. So in order to overcome this only, we have the good intervention, like intervention that help the IT intervention of smart beds, provision of smart beds, so which are automatically designed in such a way to rotate the pressure areas to prevent the pressure ulcers. And also it gives us sensors. It has been fitted with sensors to identify the patients who are at risk for fall, and it will also, along with that, it will also monitor continuously the vital signs of the patients. So the smart beds are really a beautiful invention to prevent these patient falls and ulcers. Then there are a lot of mobile medical apps which are already in practice, and so why it is of more easy for us, because would you rather see like this all our medication documents, all our case records full of numbers and small fonted letters? So it's very, so rather than seeing like this, if it is seen like this in our mobile, like an app, so where we just on a click of a finger prick, you can always get all the details related to the entire the disease, the whatever the things you need to know about the problem, health issue. Okay, so there are so many other facts about there are a lot of mobile health applications. 97,000 are there listed in the category, I mean the catalog, And many of them, 15% are designed only by the use of healthcare professionals like registered medical practitioners. And many of them are 40, almost 42% are paid thing. And even then there are 3 lakh people who are downloading the apps and using it for the everyday. Like these mobile apps, what is the risk associated is that we need to be consider all the privacy and security issues, accuracy and reliability. So privacy is everyone, every individual has the right to control how information related to them is collected, used and disclosed. And then confidentiality, that is again an obligation of an individual to keep information that was provided in confidence. Okay. So the privacy and confidentiality are very important, and of course the security. So measures which are taken by the apps to maintain the security of the information, that is, it may be the secure, that is, safeguard the information against loss or unauthorized disclosure or modification of the data. It may be the destruction of the data. So all these things have to be taken care of, the security. You can have the security without privacy, but you can't have privacy without security. So all needs to have a security check. So there are different levels of checking the security. Like at the app development level, at the development of app itself, the all the security considerations have to be made by the biomedical engineers or whoever is developing the app. And then at the mobile device level, we have a lot of other security checks, like using our fingerprint, or using face identification, or using some pattern lock or some security locks can be provided at the mobile device level. And at the enterprise level, they have to look into the maintaining the confidentiality of the data. And then there are a lot of policies and procedure risk associated with the using of these mobile medical apps. So like no acceptable use policy, and then no minimum password requirements or requirements for change frequency, lack of privacy breach protocol, and failure to deliver sticky privacy training. So all these are some of the risks associated. And other opportunities for risk, or that lack of interoperability with EHR. So if there is only adequate interoperability, it can be utilized. Many of the times they use the they insist on BYOD, the bring your own device. So all the data which we need to have in our the same only will be stored in the device, one device only. So lack of conformity to current medical practice guidelines, and sometimes there may be changes in the app platform. They do updation and other things. So that time there may be changes in the apps. So all these things have to be considered as a risk. And some of the pitfalls while designing a medical app, what are the things they need to consider is, sometimes there may be motivation for the app development. That itself will be misguided. So many times they misguide the main aim of developing the app. Some like lot of weight loss apps and so many apps are doing like this, the misguiding of the motivation of development. And then lack of clinician involvement. Most of the times the clinician may not be interested in that app, because they are almost their role will be replaced by the apps. Many times the patient who is coming attending to the clinic is knowing more about the disease and the management process. So they may not be interested. Then poor attention to the usability, and not knowing the healthcare landscape, and not building to the regulatory specifications. All these are some of the drawbacks or pitfalls in designing a medical app. So we need to consider all these things while they are developing any app. And then some of the opportunities to mitigate the risk are getting informed consent or designed educational content apps. So all the apps have to provide the proper educational content along with that. And then securing the messaging apps, and then submission to third-party testers. So it is being tested by other agencies before it is being implemented. And then in-house development, and involving the clinician in the development of app. This is again very important, because the experience, the hands-on experience by the clinician is definitely needed in developing any mobile app. And these are some of the apps which are already we have been frequently using, like the calculation of the calories of food items. Every day we just feed whatever we have taken for the breakfast. It will give you in the nutrient calculations, and like all the vital signs checking and the mobile apps for recording our SpO2 and other vital ECG pattern, vital signs, and then medication adherence apps. These are all already in practice, which have been successfully being used. And there are devices like remote patient monitoring, which provides continuous patient monitoring, acting on trends like setting inpatient and outpatient, tied to clinical decision support analytics. Okay. So these remote patient monitoring devices are already in practice, which even in the form of smartphones and smart watches, because they're already existing, where we continuously the inpatient vital signs and geoposition tracking, along with geoposition tracking and outpatient chronic disease management, activity tracker, their daily activities, how many the step counts are there, along with sensors, and then symptom monitoring. So whenever there is any symptom which is going out of the way or above the normal or baseline, it will give the warning signs and alarms. And there are a lot of issues related with this remote patient monitoring. Positive effects, if we see, it can identify all the clinical problems before it becomes into complication or crisis, like infections, heart failure, diabetes, all these things we can identify at the early stage, and the early intervention can be done. And the mobile technology, and then keeps the caregiver in loop, the doctor or the nurse, whoever is the caregiver, they can monitor the patient's uh, baseline data and other status, even though they are not available in the nearby. Okay. Then the negative things are that it need to have a quality control, and the alert management process need to be checked. So these are some of the devices which we commonly use. Complete vital signs monitoring in the form of watches and sensors. It can be used. And then some of the healthcare mitigation opportunities for the mobile apps are online patient support groups, and then patient education, marketing tool, which insist on patient satisfaction. So other digital technology, if you see, even bedside iPad app, so which gives all information about the patient's condition or the diagnosis, whichever the patient, it improves the patient satisfaction. So all the education aspect which we are supposed to give in person will be available in the iPad. So whenever they have any issues or any problems, the specific problem, they can put it in the search, and they can take over that, and they can find out what is the solution for the particular problem. Like it improves the education and health promotion, all the detection of warning signs, near misses, all that can be included in the app. And these are some of the apps which we use for even the just for hospital admission, for any, just even for, which has been fitted with all the checklists, pre-surgery checklist. What are the questions we have to ask before going for surgery from the doctor? What are the post-surgery checklist? So after surgery, what are the things we need to check? Discharge checklist, go home medications, like that. All the aspects are being given in the app itself. So before going to the hospital, before undergoing surgery, what are the questions you have to ask? How to prepare ourselves, and when so those issues, what are the issues which may face during the process? Okay. So all that are being given in the app form, so it is much easier for the patients to use. Then the real-time healthcare apps. So these again are like it gives the automated registered nurse scheduling tool. So whenever the nurse is on, it itself will change the rotation of the nurses, whoever is available for the patient care. Then when you look into all these things, the next important aspect of clinical risk, before going to the clinical risk, we need to see what are all the different types of behaviors. So the human error. So if you see, there are three types of errors which we come across when we are using the IT in our patient care. Human error, it may be a risky behavior or reckless behavior. Human error is the most nominal error which we make by mistake. That is the unintentional mistake. So risky behavior is based on the situation. Because of workarounds, we may commit some of the mistakes. That is called risky behavior. And reckless behavior is reckless behavior is something which we are showing some disregard to the rules and regulations, not obeying, abiding by the rules, all the careless mistakes which we make or termed as reckless behavior. So to overcome these things, we need to have a blame-free culture. So a culture which insists on blame-free, just and learning culture, which is a balance between the blame-free and punitive culture. That is, that's considered as a safety culture. Safety culture is that where you feel blame-free. Blame-free means without having any fear of committing or admitting to your own mistake, coming out with the incident reporting. And punitive is the punishing act. So just a safe culture have a should provide a, it must be a just culture. Just culture means when we have to follow the ethical principles, moral principles. So justice is one of the basic ethical principle which we need to follow in all our acts. So just culture is to err is human, to admit it is superhuman. That is fair and supportive treatment, honestly coming out with a report of incidents. So organizational commitment should be there to provide a just culture. So fear, there should not be any fear of punishment, critically reviewing and sharing and acting on recommendations, all that should be there in the just culture. And safety culture means that where when you provide a blame-free environment, where the individuals are free enough to report errors or near misses without fear, that is a safety culture. That is called blame-free culture as well as safe, which imparts a safety culture. Okay. And then there are characteristics. If you see the characteristics of safety culture, as we told, it should be a reporting culture, a just culture should be there. That is justice is practice. And then the learning culture. So where people are willing to overcome their mistakes by learning the right way to draw the right conclusions and they are willing to take part in the reforms. So that is called learning culture. So actually the WHO publication has given a very important point about the human factors in engineering. That is, it says that the overall human factors philosophy is that the system should be designed to support the work of the people rather than designing systems to which people must adapt. So what they say is that along with that, there are too much of information. So they have given certain issues with information and information chaos that contribute to safety incidents, because now in this information era, no, the people are overloaded with too much of information, too much of unnecessary information. So that's as actually the previous speaker was telling about the camel story, where why we need to use all the information. So like that information overload, too much of unnecessary informations are available, too much of information underload is also there, missing or not enough information scatter related issues, that is information is located in many different patients and difficult to find, erroneous and conflicting informations. So we need to analyze and take in only the needed and correct information. So for that purpose only we are depending on the HIT, that is the user and the HIT together. If they work in a congruence, then only we can, all the patient safety issues can be avoided, like no data entry errors can be done, and then timely data delivery, intact data without missing any data, appropriate use of default values, and then using the electronic systems for patient care. So all that can be possible in coordination with the IT. So according to National Patient Safety Implementation Framework, so they have given certain guiding principles to implement the patient safety. So what are those guiding principles which have been insisted is ensuring the effective and safe personal and non-personal health interventions to those who really need them, when and where needed, and with minimum wastage of resources. Okay. Then another thing is they insist on investing in well-performing health workforce, so that work in ways that are responsive, fair, and efficient to achieve the best health outcomes. Okay. And then the third principle which they mention is that establishing and maintenance of well-functioning health information system. So that ensures production, analysis, dissemination, and use of reliable and timely information. Okay. Then equitable as access. So this is again all the medical products, all the resources, mainly the vaccines, technologies. So everything should be assured equally and distributed with the scientifically sound and cost effectiveness. And then effective and efficient health financing system. So efficient and it requires everything should be affordable and that raises adequate funds for health. And then the leadership and governance. So strengthening the leadership and governance to ensure the strategic policy frameworks to exist which supports the IT usage and to see the effective oversight, coalition building, and regulation and attention and strengthening the system design and accountability. So these are some of the guiding principles which have been stressed by the National Patient Safety Planning. And then what are the strategic objectives? They also insist on certain strategic objectives to implement this framework. So they mentioned the first, they have mentioned some 6 objectives in this framework. What are those objectives means? They are the thing to support structural systems to support and quality for quality and safety, and then the nature and scale of adverse events. So has to be established. The event has to be reported. Actually, assessment and reporting of adverse event that should be reported. That is all the incidents and near misses, sentinel mistakes, all that have to be reported. Then to ensure a competent and capable workforce that is aware and sensitive to patient safety. And then the 4th objective is to prevent and control healthcare associated infections. And the 5th objective is to implement global safety campaigns and strengthening the patient safety across all programs. And then the last objective is to strengthen the capacity for and promote patient safety research. So all these are different objectives to implement the national patient safety in a safer and appropriate way. These are the priority and key interventions have to be taken into account. So again, one more scenario to look into the issues. That is, a 67-year-old patient is prescribed non-steroidal anti-inflammatory drugs for osteoarthritis pain. And the same patient is admitted again 4 weeks later with GI hemorrhage. So this is an adverse event, even though the prescribing decision was not erroneous. Recording it as a patient safety issue is honest because as the patient was harmed by the medical care, already the patient has been advised non-steroidal anti-inflammatory drugs. But what happens? Whenever we administer anti-inflammatory, non-steroidal anti-inflammatory drugs, it has to be given along with the proton pump inhibitors, isn't it? PPIs or any other counter actions to overcome the gastritis. So that so being less tolerant of these threats to patient safety, such as this, may lead to more recommendations like to take precautionary action. So the purpose, that particular proton co-prescription was not been given for this patient. So because of that, the patient has landed up again with GI hemorrhage. So this is a definite case of patient safety issue. So coming into the risk management, the clinical risk management. So risk management is that the process to identify and access the risk and to apply the methods to reduce it to an acceptable extent. So when it comes to clinical risk management, so it is an approach to improve the quality and safe delivery of healthcare by placing special emphasis on identifying certain circumstances that put patients at risk of harm and to act to prevent or control those risks. Okay. So what are the questions that come to our mind when we talk about risk management? So we have to think in terms of what could go wrong, what are the chances of it going wrong, and what would be the impact So to identify how it could go wrong, only we have the risk identification and what are the chances of it going wrong and what would be the impact. That is the risk analysis and evaluation. And what can we do to minimize the chance of this happening or to mitigate the damage when it has gone wrong. So that is the risk treatment process. The cost of prevention is compared with the cost of getting it wrong. And what can we learn from things that have gone wrong? That is the risk control, sharing, and learning. So that's what we are going to see. So what are the series of steps in clinical risk management process? So it is nothing but the first, I establish the context, identify the risk, analyze the risk, evaluate the risk, and then treat the risk. So what are the risk management responsibilities every nursing officers or nursing people professionals they have? So we need to report the incidents whenever it occurs, and we need to identify and assess the risk. We need to provide additional information on a risk if requested, then provide practicing risk management in day-to-day operation within their areas. Okay. So as a nursing manager, what are their responsibilities? They need to participate in the review and update all the operational risk profiles, and then ensuring that the risks are identified, managed, and monitored on an ongoing basis within their areas, overseeing the coherent and consistent use of risk management techniques, then participating in risk management operational decision making, having the risk management as a regular agenda item for team meetings, ensuring that risks are accurately and timely recorded in order to facilitate risk management reporting. So what is an incident? Incident register we do maintain, no incident. So incident is any event which could have or did lead to an unintended or unnecessary harm to a person or a complaint or a loss or damage. Incidents include near misses, adverse events, sentinel events, and unsafe acts. Okay. Any wrong medication errors, no, like wrong dosage or route of administration, wrong route of administration, or a dosage of medication not given when prescribed to be given, and then any wrong treatment or wrong procedure, and a staff member injured in course of their duties, then injury to the visitor or a patient, like any fall in the wet floor. Okay, so all these are some of the incidents, the patient, the mistakes, or the errors. Okay, how do I report such an incident? So a research and the incident should be entered into the incident reporting system, as we have nowadays. We used to record it in the incident register. No, so same way nowadays the intelligent incident reporting systems are available. The softwares which has already the pre-fitted questions or the format items where we need to record all the details like the date and time or when it occurred, how it occurred. So whatever the questions asked, so we need to just give it in the form of answers. Okay. The staff member reporting the incident should also inform the manager of the incident. So what happens then? So after that, the incident report will be followed via the system over the nominated manager and the appropriate quality manager. If there are risk control activities that can be conducted at their level or the local level, then that should be commenced and done. And without the matter should be discussed at the team meeting. So incident and hazards that have a major catastrophic or potential or actual outcome will be formally investigated. So inappropriate use of incident reporting to performance manage staff member to allocate. Sometimes it has been used. No, incident reporting has to be done mainly with the intent of preventing further such accidents as well as to prevent such issues, isn't it? Sometimes it may be wrongly done also, inappropriately also the incident reporting may be done. Sometimes to performance manage of a staff member or to allocate a blame for an event or for personal grievances or for harassment or discrimination. So we need to act in a judicial manner, like we need to look into the evidences which are supporting the incident, and we need to take appropriate action according to the problem issue concerned. So these are some of the steps in the risk management process. First thing is risk identification, risk assessment, next followed by risk assessment, then risk treatment, and finally we need to review and follow. So what we need to do in the risk identification, that is the basic step. First, we need to identify what the hazard or the potential problem is. Then the risk when triggered causes problems. So that it can be a internal or external. That is called the source analysis has to be done to find out the exact cause of the risk. And then the problem analysis has to be investigated. So all these unsafe acts, all the medical error or incidents are like mosquito bites. So mosquito bites, whenever we try to, you can try to swat them one at a time, but there will always be others to take their place, isn't it? So only effective way is it's not just tapping or using some repellent to overcome the mosquito bite. The only effective remedy is to drain the swamps in which they breed. So in the case of errors and violations also, the swamps are the all these things. We just can't just overcome that situation alone. So swamps are like the equipment designs or that promote the operator error or bad communication, high workload, budgetary and commercial pressures. So all that, what is the exact cause for the problem, that we have to find out and rule out the cause. We have to rule out the cause and rectify that cause, the procedures that necessitate their violation in order to get the job. Okay, so all that may be the inadequate organization or missing barriers, safeguards. So all that have to be identified, and remedial actions have to be taken to overcome that problem. Okay, only then the mistakes or the errors can be, the safety issues can be overcome. So that's what we call it as root cause analysis. First, we need to realize the problem, gather the data, then determine the possible causal factors. What are the causes which would have caused the problem? Okay, then identify that root cause first, and then recommend and implement solutions to overcome that root cause. Okay. And then failure, another way of doing is failure modes and effect analysis, where we should look into what could go wrong, failure causes, what would happen, why the failure had happened, and what are the effects. So risk assessment is to assess the potential severity of the loss and recurrence. And the treatment is that in the treatment form, we should try to accept, reduce, avoid, and transfer. So there are different measures of managing, that is the review and follow-up. In the review and follow-up, we need to use all this incident reporting system has to be strengthened, hazard and surveillance rounds has to be made, and infection control surveillance to overcome the healthcare associated infection, hospital safety committee, the safety committee members should work out and conduct meetings to overcome the issues. And then infection prevention and control committee should look after the nosocomial infection, the medication safety. They have to look into the safety issues related to medication errors, audits and focus studies. So other measures to be taken by the hospital authorities. So these are some of the safety issues, the physical safety accidents, the physical errors. So these things we have already, it has been known to you all, I hope. So we will just quickly go through the informatics related measures, what we are supposed to do. Okay. So these are some of the things to avoid patient falls. So all that civil measures where we need to prevent the skidding flooring, the slippery of floor. So all that, and then what are the safety issues of the female patient which we need to follow, and what are the measures we need to follow for a DAMA or the LAMA, leaving against medical advice, and then abscondence, theft, or anything in the hospital. So all these are the other safety issues, the physical issues which we come across. Some of the issues related to the usage of IT alone we'll see. So whenever we use the technological devices and all the like smart pumps and other healthcare or informatic devices, informatic software and hardware, what are the risks we may come across? Almost the same medication related risk, other risk and all. So how to overcome those risks? So first thing is we need to have a thorough understanding of the hardware and software. So before using any of the devices or software, we need to have proper understanding of the usage of that particular hardware or software, an understanding of the clinical functionality, appropriate use of the devices, and assessment of any known deficiencies in the existing system. So what are the possible deficiencies or what are the possible troubleshooting issues that will come when you are using the device? And we should know, able to identify those issues. And we should be aware of the clinical risk management, and we should be fully defined we should be thorough with the fully defined clinical risk assessment process, how to assess the risk and how to implement the clinical risk control measures. The clinical risk measures are appropriately documented. So if at all you come across any such risk issues, it has to be properly documented, only the like incident reporting. Then see that appropriate lifestyle management is in place. Okay. So these are some of the measures to overcome the risk associated with informatics, which we are using. Then the safety and security and the privacy involve both human as well as technical issues. We cannot blame the technical the issues alone. We cannot blame the technical side alone. So because it is the human being which are using the devices, EHR training, critical step in liability mitigation. Most mobile medical apps without clear question and answer measures, no, with quality, I mean, without clear quality assurance measures and having a clear BYOD policies and procedures, consider mobile device management outsourcing. So these are some of the measures by which we can overcome the thing. Then like use of digital technologies can mitigate the risk to some extent, like timely communication by in the form of alarm messages, text messages, patient education, getting informed consent issues. Sometimes when we are not in a position to explain very clearly about each and everything, they can go through the education app and patient engagement in case of adherence, medication adherence, and getting the patient satisfaction reports. So all that are highly possible with the help of digital technologies, which will mitigate some of the risk. And the risk management must have digital technologies high on radar before or at the time of adoption. So involve the clinicians as well as the IT people. Both of them are needed to develop any app or to use it or to overcome the risk associated with that, and look what others are doing and use all the available resources like health information, and then try to turn the liabilities into assets. So the ultimate goal of patient safety program is that we need to protect the patient from harm and prevent any complication, disability, and mortality during medical management. And beyond all technologies, at the end of the day, one must approach patient safety as a mission critical. So one must preserve physical, emotional, along with that intellectual rights of the patients. So nowadays, so holistic care, we used to be telling that holistic care and was physical, emotional, social, spiritual, like that. So now we need to include the intellectual rights of the patients also. So intellectual care also we need to provide for the patients. So one must consider patient safety as a means to improve the overall public health and safety. Okay.